An electronic signature, or e-signature, is a broad term for any electronic process that indicates acceptance of an agreement or a record. But when an e-signature is backed by a digital certificate that proves the signer's identity, it is called a digital signature. Digital signatures are recognized as being more secure and legally binding around the world, most commonly in the European Union. This is because digital signatures provide the highest level of assurance to prove a signer's identity that the signer signed a specific document and that that document and signature has not been altered. At the core of each digital signature is trust that the signer's identity has been appropriately verified. This can be done by a trusted identity authority who then issues the signer with a unique digital identity certificate. Then, to apply a digital signature, the signer simply needs to validate their digital identity, such as with an app or PIN, to sign a document. The signer's identity information from their digital certificate is cryptographically bound to the e-signature to demonstrate proof of the identity of the signer, as well as what, when, and why they signed the document. Each digital signature and the signed PDF document are time-stamped, secured with a tamper-evident seal, and encrypted. And the signed document and digital signatures can be revalidated for at least 10 years. Digital signatures are commonly used in transactions where required by law or to minimize risk when important, to proactively prevent forgery or tampering of a signed document.
The day that we had to start shutting down our restaurants. This was not easy. I remember crying.
Breaking news, all restaurants and bars in D.C. must stop serving sit-down meals in just a few hours.
To get rid of half of his staff.
We have never faced anything like this before.
This was a hard moment because you want to be there for them because you know they've been there for you. Restaurants restore who we are every single day. Obviously, shutting them down initially was hard because where do we go to restore ourselves? Adversity, unfortunately, is when the best of every human being shows up. I decided that the darkness was going to become light. When a restaurant is open, it's a lighthouse sending a very big message that the entire system is back. Food is everything. Food is our history. Food is science. Food is life. Food is love. Creativity, adaptation. Technology helps in so many ways. We used to do it with a piece of paper and pencil. Now, boom, you got it on your palm. If you work in a restaurant, you're ready for anything. You know, for a plate to come all the way to your table, a lot of things happen.
Maria, anda!
I think 2020, this pandemic, has been the year that we began being thankful for the things we really have. One dish at a time, we are rebuilding our communities back.
Yeah, sure.
File too big. What?
Hi, good morning, everyone, and welcome to our webinar on digital healthcare innovation powered by Adobe. I'm glad to see all of you joining in to the webinar and already active in the chat box. It's very nice to see. My name is Bede Owalaka from Escom Events, and I will be your host for today. And today we'll be discussing how digital technologies are transforming the healthcare industry and how Adobe is at the forefront of this transformation. So as we all know, the healthcare industry is undergoing a major shift towards digitalization. Patients are increasingly using digital channels to access their healthcare services, and healthcare providers as well are adopting digital technologies to streamline their operations and deliver a better patient experience. Actually, in fact, according to a recent report by Deloitte, the global digital health market is expected to reach around $639 billion by 2026. So it's very much growing at a compound annual rate of 13.4%. So this does underscore the growing importance of digital technologies in the healthcare industry and the need, of course, for healthcare providers to embrace this digital transformation. So we, as Escom Events, have partnered with Adobe for this event, wherein they are very committed to empowering healthcare organizations to deliver exceptional patient experiences and definitely help healthcare providers create personalized, engaging, and seamless experiences across all touch points from web and mobile to in-person interactions. So in this webinar, we're going to explore the opportunities and challenges posed by digitalization in healthcare services. We will look at how providers can use digital tools to improve care and engage patients. And we'll also consider implications of digitalization in terms of data privacy, security, and compliance. So we do aim to unite the leaders to share information that will help all delegates understand and respond to the evolving healthcare challenges in this difficult climate that we are in as at the moment. So the agenda for today is first a panel discussion followed by a solo presentation. And we do have a great set of speakers here with us today who will be introduced shortly. But before we do dive into the first session, just a few housekeeping rules I'd like to go over and share with you guys. So as I mentioned, you guys were already active in the chat box. So do feel free to engage in the discussions using the chat box on the right-hand side of your screen. There you can make comments in the public chat. You can drop your questions in the Q&A tab. There will be a Q&A session to address the questions that are asked. And of course, do take note of the poll question that we asked towards the end of the event. Your participation would be highly appreciated. So with that, let's move on to our first session for today, which is the panel discussion on modernizing your healthcare experience delivery. To moderate this discussion, I would be calling on and welcoming Dr. Adam Chi. So Dr. Adam Chi is the Chief of Smart Health Leadership Center of the Institute of Systems Science at the National University of Singapore. He's a convergent scientist very familiar with healthcare informatics, innovation technologies, and equally important, the business aspects of the ecosystem. And he does serve as a coach and conduit between various key opinion leaders and stakeholders engaging at operational and strategic government levels, as well as developing commercial relationships with global firms and local startups. And all of this, of course, is for the utilization of health, informatics, and digital health as an enabler in addressing the challenges of new and existing models of healthcare. So we are very glad to have him here today as he brings with him more than 20 years of health informatics, digital health, innovation technologies, and business experience. And once again, as I mentioned, should you have any questions for the panelists, do feel free to drop them down in the chat box and they'll be answered during the Q&A. So over to you, Adam, as you help us bring in the other panelists and pave the way for this discussion.
Thank you so much for the kind introduction. So I'm not going to talk about myself anymore. I'm just going to proceed and invite other panelists to provide a 1 to 2 minute short introduction of themselves. And I'm going to go in a non-sequential order. I have a list of the speakers here. I'm just going to call out your name. So please kindly give an intro when I call your name. So first we have Rajesh. Rajesh, can you please kindly introduce yourself?
Yes, good morning, Dr. Adam, and good morning, everyone. Thank you so much for joining our session today. My name is Rajesh Patil. I take care of the channel and territory business for the digital media side of our business for Adobe Southeast Asia. I'm based here in Singapore and have been helping our customers to grow into a less paper office. So that has been my advocacy, and that is where I excel in. So nice to meet you all, and that's my quick intro.
Thank you. Can I call upon Saravanan next?
Hi all, my name is G. Saravanan, can call me G. I'm the group CIO for Thomson Hospital. We are currently in 2 countries, Malaysia and Singapore. That's all.
Right. Thank you so much. That was very short and brief. Can I have James, please? James? James, you're muted, James.
Sorry. Yeah. Hi, I'm James Indina. I hail from the Philippines, and I've been in the healthcare and insurance industry in the early 2000s, and I transferred to a hospital, Chongo Hospital in Cebu, at the height of the pandemic in early 2020. Yeah.
Thank you, James. And lastly, we have Dr. Aditya. Not sure if I'm pronouncing your name right.
Yeah, thank you, Dr. Adam. Hi, good morning, all. I'm Aditya Nugraha. I'm working as a hospital director from Primaya Hospital that already operate nearly 15 branches in Indonesia, and we already developed digital and electronic medical record. So we implement it before the pandemic and after the pandemic. Thank you.
Right. With that, what I'm going to do is I'm going to pose some questions to the panelists, and let's see we'll get out of this discussion. Now, the first question I have is, there are changing needs, expectations in terms of experiences, tools, and operations of employees, patients, and stakeholders, especially after the pandemic. So I'm very sure you guys have seen similar trends across ASEAN, Asia Pacific, before COVID-19. When I talk to people about what I do, they'll be like, "Oh, it's IT." It's actually not. But after the pandemic, everyone seems to be an expert in what I'm doing, including my other side job, because I'm trained as a public health professional. So suddenly after COVID-19, everyone's an epidemiologist. So they're changing expectation. So maybe what are some of these changing needs, expectations that you have seen in your country? And I'm looking at the list on my screen. It may differ from yours, but I'm just going to go from left to right. So maybe Dr. Adia, maybe you can start first.
Yeah, thank you. Actually, in my country, not all of the hospital already developed the electronic medical record, or like you said, that some of them still thinking that it's just IT. But after the pandemic, or in the pandemic era, we know that telemedicine already proved already. Some of the third-party operator developed the system to help the patient and the doctor meet by telemedicine. And right now, the MOH already sent out the new regulation that all of the hospital should have electronic medical record at the end of the December 2023. And so this is the developmental time for its company. So some of the hospital company already developed by themselves, or right now they try to make some MOU with a third party operator.
I imagine that's going to be a lot of work in terms of expectation, changes of clinical workflow. I'm curious, are there any signs of stress and worries from the healthcare employees that their job will be made redundant?
Yeah, of course. Before the electronic medical record, of course, take effect. Take a very big impact on the hospital workflow. Like before the EMR, we use a lot of paper, and right now we didn't use paper at all. we try to make environmental sustainability and to reduce the paper. So the main problem is change of the culture. So before the EMR, so the doctor just write it off, and right now they should type it and then click there, click here. So it will be take a lot of problem. And then how to make a receipt, how to order some laboratory or radiology examination, how to and entry the data of the patient since they admit, and then when the time of discharge and so on. So yeah, right now it's still challenging, especially in the hospital that didn't implement the electronic medical record. And now we just given time of 1 year. We just given start August 2022, and at the end of the December 2023, all of the hospitals should have electronic medical record, because our government developed a new application called Satu Sehat. So they hope that all of the data, all of the electronic medical record in the hospital can integrate with the system with the government. So when the patient come to one hospital to another hospital, they just transfer the data. So of course, it will be a new problem with the cybersecurity.
This is interesting, and I foresee a lot of opportunities for the Indonesia market. So with that, I'll shift it to James. James, you've obviously done some digital transformation work over at your end as well. Perhaps you can share your thoughts on some of the changing needs, expectations in terms of experiences, tools, and applications, etc., etc.
Yeah, thank you, Adam. On my end, no, what we've done is try to digitize and cloudify things. When I say that, no, I mean that transferring the typing into the keyboard as well as writing on the paper, we've done mediations towards that. So we transferred that into, so for example, a mobile app for the doctors wherein they could submit their professional fees, so that our nurses don't chase the consultants, attending physicians, whenever a patient needs to get discharged. So it cuts the processing time so that the turnover is faster. So it was quite a challenge then, because the level of IT knowledge for some of the consultants aren't the same. So we've had to endeavor and really try to convince them to submit through the app that we created, so that we could have a faster churn in terms of room availability. Now it has been over a year, and we have seen quite a lot of um, subscription to this new form of interface in terms of submitting their PF, interaction with the doctors, getting news to their end. We now have almost 80% compliance whenever a patient gets to get discharged, and when we have this interaction with the physicians, attending physicians, we have more suggestions on how to what features to include in the app. So yeah, those are some of the features. And now we have launched since then two more apps to form the um, ecology, if you may call it. We've launched two more apps to include residents as well as patients. To form, however, the complete ecology, we need to launch an app for the nurses, so that the servicing capability of the hospital is all there. It's all in a digital platform, whether there's an Android, an iOS, a desktop, or notebook. It's one coding, so that we do not need to really code one application for a certain platform. It's all in one package that we've deployed it. Yeah.
That's just a very nice architecture. Thanks so much for sharing, James. How about G? Do you have something you'd like to share?
Yes, thank you. So I guess the question is, in the recent time, since COVID-19 especially, what kind of changes we have seen in the country? So I can share a bit on that. Firstly, a quick history. So in the region, if you check, Malaysia is one of the earliest nation to ever launch its telemedicine blueprint. So if you check in the region, our blueprint is about 25, now it's 26 years old. In 1996, we launched a telemedicine blueprint in Malaysia, but that's history because in the recent years, sorry, I'm hearing some disturbing noise. Okay, in the recent years, we have gone through many cycles, many projects nationwide. In fact, in the past 3 years has been the most interesting. I'm sure many of you would know we had 3 governments change in the past 3 years. So 3 governments in 3 years is record breaking for a country like Malaysia, especially in the previous 23, 24 years. We had a very stable government, single prime minister. All right. So why I'm talking about politics is that because when a prime minister change, cabinet change, government change, what do? They launch new agenda, new blueprints, new roadmap, and so on and so forth. Hence, our EMR, EHR plan has also been changing. All right. So either good or bad. So every health minister which has come on board has announced that in the next 5 years, the whole country is going to be connected via new EHR, EMR. All right. So I'll leave it at that. Okay. But the good news is that we know we need to change. We know we need to adopt. In fact, we know that we need to roll out the roadmap for the EMR, EHR. So that is taking place as we speak. And that's tightly connected to what happened during COVID-19. We never had a tool. We never had a device in the patient or citizen's hand which they could access their PHR, right? And now we have. So that's why I say that COVID-19 came up with a lot of silver lining, right? The cloud. So yes, so that's one thing which is taking shape. That's number one. That's more on the clinical, medical records, EMR, PHR kind of a thing, right? And quickly, I need to touch about insurance market. Now, in the past 20 years of my experience in healthcare, I always thought healthcare is an independent industry, similar to telco, banking, fintech, and whatnot, right? In my recent time, I realized it's not. All right. So the healthcare financing part, the insurance market, is very tightly integrated with the healthcare market itself. And again, probably thank you to COVID-19, the insurance industry has also realized that, and they are also spearheading a integration between the insurance industry and the EMR. And I'm sure Rajesh will like this a lot because this means paperwork, lots and lots of paperwork. All right, countless of paperwork is going to be digitized, integrated for easier workflow between 2 separate, I would say, gigantic industry, insurance and healthcare. I'm not going to go into specifics, but all I can say is these industries, these giants are being integrated. And quickly, of course, how can all of us forget 5G, right? The talk of the town. So 5G is taking its own transformational shape as well in Malaysia. So yeah, I got more to share, but later more. Thank you.
In reality, we're all facing similar problems in different stages, in different forms. But I do agree with you, G, wherever there's a change of health minister, job creation. Yes. But I'll leave it to that. Yes. I'm going to flip it to Rajesh with a slightly different flavor. So, the rest of the panelists come from a healthcare provider and you come from a technology provider. And so what do you see are the changes in terms of not only just healthcare, but also in other industries, that they have adopted in reflection of recent times?
Thanks for that question, Adam. So definitely, it is not just one particular industry, right? The pandemic actually became a catalyst for everybody's digital transformation journey. So everyone thought about digitization as a good to have before the pandemic, but the pandemic actually helped them fasten it, make it into a much faster process. The CIOs, the CMOs, the leaders of the business started looking at their customer experience, started looking at their experience without being in touch or without being in person with their customers? How can they drive this? And that is changed tremendously. So I can say that we have seen a shift which is kind of a 5 years leap in terms of digital transformation. And as you mentioned, correct, that everybody is in a different space in their journey. So every time somebody says, oh, I've done digital transformation, the moment they say I'm done digital transformation, they are kind of done, because they are not looking at it as a journey. But this is a journey, and we are working with very varied industries. So take a look at manufacturing, take a look at FSI, which had to change a lot. And to G's point on insurance and to payments, that was one of the key areas. We saw a couple of very big shifts happen here in Singapore with a couple of customers. So overall, the drive towards digitization hastened because of the recent pandemic and the situation that we went through. But moving over now, we are in with 2022, people started saying that, oh, okay, we are over this now. But the digitization journey or the digital transformation experience remains there. It is not something that will go away quickly, because they have realized, every business has realized that it is important for us to come up to the customer expectation. Customer experience has become the key today. And every time we speak about customer experience, we think about the beautiful videos, the beautiful text, or something like that. But forms, which are the mundanest way of collecting information, if we can, go back to what James mentioned about, having an app so that people are directly keying in their own data. So I'll give you a very nice example that one of the customers told me that, earlier they used to do data entry. So they used to take everything written on a paper. Then the data entry operator used to do data entry for them. For me, if I'm writing my date of birth, it is an important date. For the data entry operator, it is just a mix of dates, right? It is some month, some day, some year. So the errors have gone down with this particular customer of ours. The errors went down by 80% since they have started this form in a digital format in the hands of the user. So that has gone and changed the way businesses have taken a look at it. So it is not just the big impact from the ROI perspective or from the investments or optimizing their investments in the systems perspective, but even these smaller things which customers are feeling a lot more closer to these organizations who are on the digital journey and who are embarked it and creating those very small wins, very small customer experiences. So that is where we see most of the industries, including healthcare.
It's interesting that you mentioned it, because in terms of documentation, in the healthcare setting, in the hospital setting specifically, nurses do a lot of documentation.
Yeah.
And even though in Singapore, for example, we have gone through several rounds of digitization, optimizing workflow, they still spend quite a fair bit of time handing over, even when there's electronic medical records in place. I wonder if this is the similar trend that we see in other countries. Any of the panelists have any insights?
I can share something, Adam. So it is said that in a typical 1,500 bit in a month, they generate almost 8 million pages of paper. All right, that's a staggering amount of paper, and I think we are all guilty of doing the same. Okay, so that is why even in Malaysia right now, this is a trend among the CIOs, which we have a connection with, right? In Malaysia, we have a tendency right now to start a project to first assess where and why are we using paper. And this is in line with our digitization plan as well, because once we identify when and why we're using paper, then the next stage would be how can we reduce the paper actually. And usually we take this along whenever we are either we're implementing a new HIS EMR project, or we are coming up with a new mobile app plan for the doctors, for the nurses, for the patient. It's a good time for us to identify the key points where paper gets generated, paper gets consumed, and so on. So this trend is also happening, because you know why? Two reasons. Number one, when you have paper, the data is not digitized. When data is not digitized, you lose the opportunity to capture the data, to analyze the data, and you hamper the process to go towards, I don't want to use big words like AI and so on, but even to understand the trend, even to assist the business to identify how to optimize the operation. So it's a big business blocker, it actually hinders us from moving forward, so it's an important trend going on right now. Yeah, anybody else?
Yeah, I'm really agreed with Mr. Saravanan because with the digital data, we could have a business intelligence that we could analyze the data. That is of course very difficult when we only have a paper and we should have a summary from the maybe 1,000 page of paper. And right now we only use AI to summarize the data, and we could analyze it very yeah, of course it's very easy right now. And then like Mr. Saravanan said that right now in Indonesia, the government healthcare system, government healthcare insurance already integrate with the hospital EMR. So we didn't need to send all of the paper that maybe for each month we should have some of the box to just to send out to the government to make them pay, of course. And right now we just send the data. So it's very, 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 very easy. And then from the nurse, of course, from the nurse side, when we have EMR, we reduce the opportunity to lose the paper because when we have a lot of patients, sometimes with a paper we could lose it when we transfer from the OT to the ward or from the ER to ward. Some of them maybe we lost some of the paper, but with the EMR we reduce the risk.
If I may, I just want to add a bit. See, there's another opportunity. When you remove paper from the operation, you're also reducing patient waiting time in a huge extent, right? So when you digitize, for example, Dr. Aditya will know better, when Indonesia rolled out their BPJS program, whereby 20% of private hospitals' bed has to be allocated to the common man out there, they have also enforced the private hospital to submit all claims, medical records online to the government hospital. So they saw the 20% of this patient, immediately the admission time, discharge time is much more faster. That is a trend which Malaysia is trying to follow as well with LIAM, our Life Insurance Association of Malaysia, where we want that to be directly integrated for all the insurance patients at least. And this is the way we should be going. So by reducing paper, not only you help the environment, you also make patient waiting time, operation become better. Yeah.
Yeah, agreed. Because before we digitalize it, when the patient use the BPJS Kesehatan, they should write the data first in the administration, and then they should bring a copy of the card or the copy of the referral letter, and then after that they should have a resume and so on. But right now, when we already integrate, they just type it with their phone, with their smartphone, and the data already sent to the hospital. They just come, fingerprint, and clear. So yeah, reducing waiting time and increasing patient journey. And
it's funny, 20 years ago when I was implementing hospital in Jakarta, they were learning from us. But right now, we are learning from them.
Nice.
Yes, back to you guys.
James, would you have anything to add?
Yeah, I just like to answer one of the questions in the chat group. No, it asks for the success factors in implementing the apps that I mentioned earlier. As a benchmark, no, or as a baseline, we had, yeah, that's the question. We were expecting a 70% adoption from all our consultants in the use of the app and the submission of the professional fees. Happy to say that we've been able to exceed that. No? We have around, of the 700 plus consultants that we have in the hospital, we have over 100 and around 150 interactions on a daily basis. So, and more than 70% of them submit their PF through the app. So yeah, management has been very happy on that, which is why we've been asked to build more and complete the ecology to include the residents, of course, the patient and the nurses later on.
That's very useful to know. Thanks so much. I just want to put one point that G has mentioned during his sharing. Sustainability. Now, green is a big thing in Singapore. I don't know if, I think Rajesh would know, but for the rest of the folks on the panel, the government of Singapore has actually came out with some plans with regards to green. And there are some, I can't recall all the details, but there are some stipulations and regulations by a certain time, certain point in the future, we must cut down X number of emission, etc., etc. Now, the general misconception is that if I move everything online, everything goes onto the cloud, I'm actually reducing carbon footprint. This is true and not true. That's number one. Another thing I also found out in Singapore, in fact, just yesterday, I was doing a on-site observation. Now we have electronic medical records in all our government hospitals, private as well. And I still see them using P-files in conjunction to the electronic medical records. I didn't ask them why. I was just doing an on-site visit. But I don't know. There are no pressure to be sustainable, reducing waste, etc., etc. Would you guys have similar pressures, KPIs, objectives over at your side of the region that is stipulated as part of your mandate to roll out electronic medical records? And I imagine the impact to be bigger in your countries because you guys are so much bigger than Singapore.
I'm waiting for the rest.
Would you like to add?
I can. I was waiting for others to start, but anyway, yes, I can. I think a few questions there. Okay, quick answer is this. There's, at least to my knowledge, so from the government, there's no such KPI or motivation or push to reduce paper, because I guess they got to do it first before they can tell the private sector to do. It's number one, and they are not doing it. That's for sure, right? And that's got to do with how they are rolling out their systems and so on, right? But as a private sector institution entity, I think we are more self-governed, especially the ones which are public listed. We have self-governance. Like we ourselves here, we are going for ISO 14,000. So the fact that we do assessment when and why using paper, and how can we reduce paper is our self effort, right? And I know my fellow CIOs in the country are doing it themselves. And for many reasons: patient waiting time, get more data, optimization, cost control, ESG, more green effort, reducing carbon footprint. These are the reasons, all right? That's the first part. And then, sorry, what's the second part of the question again?
Pressures of impact that's driving you guys to implement electronic medical records in conjunction to green. Yeah.
Okay. So with regards to the pressure impact, right? Again, I like to share that the government side, they are unable to push. But there's one effort which came about in thinking about 2007, 2018. The government mandated that every healthcare institution, be it public or private, we need to share the discharge summary of every single patient with the government, electronically speaking. So they did expose an API. There's a FIRE. No, it wasn't a FIRE, actually. They attempted FIRE, but didn't work out. HL7 data has to be shared of the discharge. Even that didn't work out because that's got to do with infrastructure and so on. So they could not sustain. Also enforcement, right? So government needs to be very persistent the way they enforce, they audit, and so on. So that requires a lot of political will. And again, I want to bring up the fact the government changed. That went down the drain as well. Okay, but again, being private sector, we are very strict in terms of our roadmap, our blueprint. So we have a vision, and we plan to achieve that. So internally, yes. COVID-19 is changing this though, like what I mentioned. COVID-19 is centralizing medical records of the citizens on the cloud. So government has started rolling out the COVID-19 passport application. We call it My Sejahteraan down here for their own government use. And the private sector contribution is coming very, very soon. And the last part to add, I like to stress this as well. Healthcare financing is something serious to make healthcare services sustainable, both private and public. And that's also coming. And I'm sure everyone knows what's going on in the US with the fact that HIPAA is there, and DRG is coming soon as well. Because without DRG, I'm sure everyone knows, healthcare financing is not sustainable. Pay for service will not run for very long. It has to be paid for value.
It's interesting that you mentioned pay for value, because in Singapore, we're embarking on capitalization, which is actually value-based care. You're going to roll out the first tranche in June, so it's akan datang, coming soon. We'll see.
But then again, you are Singapore. You have to be the first in the region.
I'm not so sure about that.
I know. I'm just complimenting you.
Thank you. So maybe I'll move it to Indonesia, because this is a new initiative that's coming up. And as mentioned earlier on, you guys have a 1-year timeline. That's actually very ambitious, given how big Indonesia is. So maybe, Dr. Adia, maybe you can share with us some of your insights regarding this.
Yeah. If we talk about the pressure, so there's a direct pressure and indirect pressure. Because if we talk about the direct pressure, yeah, the new regulation make us the hospital, of course, to reduce carbon footprint. So all of the hospitals should use electronic medical record at the end of the December. And indirectly, like with the insurance, so the faster we submit the data, so the faster we get paid. Of course, it will impact the cash flow for the hospital. So when we use the digital data, it will be so much faster than we use conventional or with paper. So indirectly, we should move to digital. And then some of the KPI from MOH should be submitted with the digital data. So they just change the paper report that should be sent monthly to the data that should be sent daily. So of course we should change. We should have a digital data. And then from the internal side of the hospital, when we use electronic medical record or digitalization, of course it will reduce the cost of the hospital itself from the manpower cost, because there's a lot of reduction in manpower cost when we use electronic. And then waiting time, and then we reduce the space from the hospital, from the like we said, when we have a lot of paper, we should have a lot of storage room. And then when we use data, we just use server, cloud, and so on. So directly and indirectly.
Thank you so much for sharing. How about you, James?
Yeah, I'd just like to make a follow through on Dr. Aditya's comment earlier. Here in the Philippines, we have PhilHealth as government insurance, and we do submit our portions of the claims to them. It's been very challenging for a while, especially during the height of the pandemic, because there is an increased number of healthcare submissions. Hopefully, they'll be able to really fix the infrastructure so that claims can flow through very fast. No? So, we also have the universal healthcare to keep in mind. So, having said that, we expect more availments in the hospital for all the citizens of the Philippines that will be covered. We need to be able to expand and service more patients moving forward. No? What is needed, however, is standardization. When I say that, services needs to be standard. All insurance entities, to include healthcare insurance (HMOs), needs to interface with the hospital, so that items like letter of authorities or LOAs that needs to be issued doesn't need to pass through the call center anymore. It should be electronically. We should be electronically communicating from one server to another to hasten and for the betterment of customer experience. So, yeah, so those are the things that both the private and the government sector needs to work on, so that we could have better healthcare and faster healthcare services rendered to our patients, both private and public.
I totally agree with you, James. Yeah, people need to be able to share information, data between different agencies, regardless of whether if they're from the same ministry, organizations, etc., etc. It's no longer a technology problem. So even G mentioned earlier on that in Malaysia they tried using several standards. We have it as well, and I always keep telling people it's not a technological problem; it's a policy
Yeah.
issue. Yeah, they have to stop pushing it back, saying IT. It's not IT. They have to solve their
Yeah.
policy. So I totally agree with you.
Adam, if I may comment, on my experience, technology is not really an issue, because you can either build or buy. It's more on the culture and believing that you can implement such things that really matters. So I think that's what's hindering us to really speed moving by leaps and bounds. So if that is not settled, then we can really move faster.
I totally agree with you. Culture is the number one issue I have sometimes when I do projects as well. Not invented here. This is how we have always been doing it, etc., etc. But we'll come back to that later. But Jess, on the other side of the pond, we obviously done projects not just in healthcare, various other industry as well. So have you seen how companies have managed to address sustainability issue, carbon footprint? Can share with us some examples?
Yeah, sure. So, Adam, it has got a range, right? It has got a range from I need to have it in my annual report as a green take to anally focusing on it and trying to reduce the carbon footprint. So, sustainability for all our customers today is in that broad range. It can be just a take that, oh, the CEO called out something in the annual report, and that is what we need to probably stick to. But yes, there are challenges across, because there is not enough that is done from a policy perspective. That said, there are always private organizations or huge, large conglomerates who have taken up upon them to reduce the carbon footprint, reduce the number of sheets of paper that they're using on a regular basis. And that is something that we are helping with. So, giving you an example, we were working with an education institute recently, and it was more towards the prospectus and the enrollment forms for the students. They actually saved about 100,000 sheets of paper being printed in a month. So 100,000 sheets of paper in a month is a huge amount when it comes to the kind of carbon footprint. And this is what gave the team to actually come up with an ROI calculator. So I'll be more than happy if at all any one of you would like to probably speak to us, and we can actually go deep dive into what kind of sheets of paper are getting used on in a particular department, and go across the departments to figure out what exactly will be your impact on the carbon footprint, on your sustainability goals. At the same time, gallons of water that you are saving, the number of trips that are getting reduced because somebody had to take that paper, courier it to somewhere else, and then get a signature done and stuff like that. Two, how much in dollars are you saving because of this particular process? And lastly, how beautiful is the customer experience so it is causing a range of positives for our customers, and this is what we are working on with most of our customers across the Southeast Asia region. As I said, there are some who are doing it just because it's a green tick, but there are some who are really, really serious about it.
Rajesh, I'm going to take your offer. Rajesh, come over. Let's evaluate. How can we reduce
Absolutely.
paper? Please
Absolutely,
come.
G. I will make sure that I'm having coffee with you in my next trip to KL.
Please do.
I will.
Fantastic, fantastic. I like the way you describe it, Rajesh, a tick in a box. My daughter, when she was young, she would describe it the other way. She says, "Stop killing polar bears." That's her way of articulating
Yes,
carbon
yes,
footprint. Yes, you got to
yes.
stop killing polar bears,
Agreed.
which I think is not wrong as well. So that was very useful to know that there's tools out there for us to measure our sustainability impact. I'd just like to route back to James' point on culture, because this is part of the barriers towards adoption in many countries and companies. Now we hear that in Malaysia and Indonesia, there are government mandates, 1 year, 5 years. You have to go it through, and of course, Philippines is doing it well. And I'll be honest, you guys have a lot more challenges than we have over in Singapore. The beauty of being small is we get it done fast, and it looks simple. When you have infrastructure issues, geographical disparity, other pressing issues in the country to address other than electronics and infrastructure, things are not so easy. So other than culture, of course, policy, culture, finance, what are some of the other barriers towards adoption that you guys are seeing over at your side of the pond?
Well, my challenge mainly,
Okay.
my institution being a traditional, we've been around for over 100 years, is really culture. That's the main challenge, and you need to be able to convince people that shifting to this kind of technology or process is a better option than remaining stagnant. You try to play on their the people's strength so that you could be able to convince them. In our case, the app that I mentioned earlier, and there are more coming, we tried to do a stick and a carrot. Um, yeah, so we convinced the users that if you do this, you'll have a better turnaround time in terms of getting your money in the bank. So in our case, that's the professional fee. So uh, I don't think I have any more challenges apart from the three that you mentioned. Those are the three main points that I usually deal with.
Okay, I'm going to say the same thing in a different format. So I call it 3P: the people problem, the process problem, and the product problem. All right. I think this goes, I think you
Okay.
will agree with this. I mean, when you say culture, culture is such a huge word. I think it helps to break it down a bit. Look at the people culture problem. The people don't want to change. I'm not going to blame the doctors. I know I got two doctors in the room right now, so I'm not going to talk about the doctors. But I think too much focus is, or too much blame is given to the doctors. It's not the doctors alone. It's all the people, including the IT. Why
Yeah,
do I need to move to the cloud? How can you trust the
yeah,
cloud, right? What if my internet goes off? The ITs are culprits as well, right? So let's
yeah,
look at ourselves. So I don't want to dwell too much, but people definitely is an issue, right? Process is a huge thing. The process is a bigger problem. You know why? People you can see, product you can see, process you can't see. And this is a cultural problem because we don't tend to document down processes. And when you don't document down processes in people's mind, how do you change from the S, is, and to be? Huge thing, right? Process. Third, the last and the biggest giant of all, the product. When I say product, it's hardware products, software products, and so on. So honestly, this is too much to discuss in one answer, but because it's the 3Ps is the issue. Yeah, next.
Yeah, can I add the fourth P here? Every time a customer would always look at is pricing. So that's the fourth P there.
I mean, you can't help it, right? We run businesses, government. Pricing
I
is
agree.
important. Actually, I got the fourth P and the fifth P. It's actually partner in projects. I do want to say that. Okay, so I got the whole framework done, but yeah, but you are right.
Great.
Pricing as well. There's a lot more P's.
Yeah, great. Because some of the people it's very difficult to change before to change the culture, and then for the pricing, yes, of course, because in some company which should implement with a new system, of course, there will be a new cost and new price, and then product. Because yeah, some of the doctor that already use maybe because in Indonesia, doctor could practice in a three place in a three hospital or yeah, a three place, and if the doctor already practice in one place using their EMR and then practice in another place using their EMR, of course, so they will compare the yeah, the operability of the one EMR in a hospital and with another product. So yeah, some of them make a product and people problem because yeah, when they compare, they just said that it's more easier in there than in here, right? Some of them like that, and then product because we should for from the hospital side, from the company side, we should have a trust with the product when the product is not hospital developed. So when the product is third party developed, so we have a security issue, we have a trust issue, because with the new regulation, the data should be stored until 25 years. So how could we have a trust with a new product or on some of the company to make sure that our data is safe 25 years later? Yeah, like that.
Looking at the timeline, it's 11:25. I know we're supposed to finish by 11:30, and there are some questions.
So
I'm
I'm
not going to
busy.
go
I'm
through the
busy replying
questions.
the messages. I
Yeah,
know we don't get the time to answer all of them.
yeah. I think that's going to be a tough. But what I like to do is to take this opportunity to maybe have everyone share one last or two sentences, some advice or words of encouragement they will give to the audience if they are embarking on a similar journey of digitalizing healthcare services. Maybe we can start with James.
Yeah. Thank you, Adam. I just like to say that if you have a vision, you need to be able to sell it. Sell it to your management because if it's just a vision and you're not able to sell it, you cannot execute. So you need to become a good salesman. You need to believe in what your vision is and try to sell it to your management.
I think that's very valuable advice. G?
Okay, get to know your why, your WHY. If you don't know why you're doing something, stop, look back, discuss. Solve that first. The how, the what, the how much, and when, all that will fall into places. That's it.
Fantastic, fantastic. Dr. Adia?
Yeah, we should ready to change because if we are not changing, we will be lost in a journey.
I might need you to repeat that to some of my users. And Rajesh, other than pricing, what other advice would you have for the audience?
So the advice would be to actually look at a partner, a solution partner who has been in the industry for a longer period of time, has a product that is robust and compliant. So that is what would help you take through that journey. And coming to one very specific point that Dr. Aditya mentioned about the 25 years, just wanted to share that Adobe has been in the industry for the last 40 years, and the PDF as a format is an open format. It is not a format that is owned by Adobe. So when we are looking at archival, we are looking at worldwide standards organizations archival standards. So it is not just an Adobe standard. Just to put in a plug there because I couldn't resist it.
No worries. With that, I would like to put a conclusion to today's panel. It's been my absolute pleasure, moderating this panel. Some great discussion. In fact, I think I might go back and steal some points and use it with my end users. Having said that, I'll see you guys around. Take care.
Bye. Thank you.
Bye-bye.
Thank you, everyone.
Thank you,
Thanks a lot.
everyone.
Great. That was a very insightful, engaging discussion. Many questions.
I'm still busy answering the questions.
Many questions did come in as well. Actually, apologies to all the delegates if your question wasn't able to be answered. But should you have any further feedback or questions for the panelists, you can also connect with them in LinkedIn. Maybe they'll be able to take your question there personally as well. And of course, I would like to take a moment to express gratitude to our panelists, Dr. Aditya, James, G, Rajesh, who actually will be joining us in the next session as well, and our moderator, Dr. Adam, for sharing the valuable insights and expertise with us today. Of course, all your contributions have truly enriched our understanding of modernizing the healthcare experience delivery. So a virtual round of applause for all your wonderful participation, and we hope to see you all in our future events. And with that, we do move into the final session of the day. But before I do so, I would like to actually share a quick video with you. So just give me a brief moment of that and stay tuned as Rajesh will be joining us in the next session. So welcome back, everyone. And also, I should say greetings to anyone who may just be joining us here this morning. And I would actually jump into our next session right away. So as you mentioned, Rajesh will be the one presenting as of right now. And for those of you who may have missed his intro earlier on, so Rajesh does lead the mid-market channels team for Adobe Creative Cloud and Document Cloud business in Southeast Asia. He's very passionate about helping content creators and knowledge workers boost their productivity through mobility, ease of use, and AI for those mundane tasks, which allows, of course, people to focus more on their creativity and higher value work. And being with Adobe for more than 16 years now, he's a firsthand witness to the most talked about digital transformation journey today. So over to him as he presents on digitalization of healthcare services with Adobe. And once again, should you have any questions for him, do feel free to drop it in the chat box. Thanks. Over to you, Rajesh.
Thanks, Beat. Thank you. Let me just start my deck.
Yep.
If you can just confirm you can see it.
All good.
All good. Fantastic. So again, welcome to this presentation. It is going to be a continuation of what the chat we were having with our panelists, and kind of has made my presentation a lot more easier. But let me just get you through this. So changing the world through digital experiences has been Adobe's mission since the company's founding 40 years ago. From the morning you wake up till the time you go to bed, the content you see, the apps you use, the websites you visit to shop, learn, play, chances are that every bit of technology that you touched has been in some way touched by an Adobe solution. Adobe is providing our creators, our experience creators, tools and services to make the journey a lot more smoother and to create beautiful digital experiences, be it across industries. So today we are going to take a deep dive into healthcare, but let me just share with you what it means from an Adobe perspective. We are looking at Creative Cloud, the product where all the content creation begins. So it's an entire customer journey, if you see, from development, marketing, sales, and service. Creative Cloud is the place where you would create that beautiful content, that engaging content, to serve to your customers, both internal as well as external, to make sure that they are engaged with you, to make sure that they spend time with you, they spend money with you, and they spend their eyeballs with you. When you are serving this experience onto any of your digital properties, be it applications, be it your website, be it your social media, everything, and to analyze how that particular piece of content is working for you, that is where Experience Cloud comes into the picture. Experience Cloud allows you to run campaigns and understand analytics on your websites, on your social media channels, to gauge how your content is doing, how engaged everybody is with your content, and how you can improve that to make sure that it is a more robust and a beautiful digital experience for your customers. And lastly, we come to the Document Cloud, the last mile, where we are speaking about digitization. We spoke a bit about digitization earlier in terms of manual paper processes and stuff like that. That's where Acrobat, the Document Cloud, would come into the picture, and signing it off as an electronic piece of information and saving it or archiving it as an electronic piece of information. That is where Document Cloud with Acrobat Sign would come into the picture. Now, this is again across your internal processes or any that are customer facing for you. So let us see where healthcare is today. It is obviously, we heard from the panelists that there is a pressure to evolve because members, patients, customers like you and me have actually understood what better digital experience is. We are interacting with websites, we are shopping, we are playing, we are learning and working on digital platforms where the experience is much more seamless, the experience is contactless, the experience is delightful. And that is where the member and patient expectations from healthcare have gone through the roof. They expect the same kind of experience from the healthcare community as well, from the healthcare businesses as well. It is the disruptive conditions have actually fastened it. The disruptive conditions have actually been a catalyst, as I mentioned earlier. What happened with COVID, what happened with more and more people having to sit in their homes or in their respective places, but having to conduct their day-to-day jobs. So it be it doctors, be it nurses. So that is where telemedicine got a lot more popular. That is where electronic document sharing got a lot more popular. So that is where disruptive conditions came in. And obviously internal efficiencies. Today healthcare has to look at internal efficiencies to see where paper is used, as Dr. James mentioned earlier. James mentioned earlier that there is an app that is there now, and that is where the paper process is getting smaller or lesser and lesser. And those were the challenges, being in person, being there on a particular time and date. Those are the inefficiencies and the reliance on paper that creates those challenges there. And security requirements, definitely, with everybody wanting to move digital, everybody wanting to get onto digital, how can they be sure that the product is right, it is secured, and it is compliant to the standards? So what is Adobe bringing to the table? The Adobe Acrobat Document Cloud, as well as Adobe Sign, Acrobat Sign, is bringing to you to close that paper gap and to make sure that there is a compliant ID verification along with audit trails to make sure that who signed the paper, where the paper came from, creating a seamless workflow with a security and compliance tied into it, into the DNA of that particular document. Collaborations and integrations are a lot more easier with workflows that are digital end to end. It is not like you're going to through a digital workflow, and in the end say, oh, I need to print it and then probably sign it and then scan it and send it back. So there is no break in those collaborations and integrations when we are talking about the Adobe's Document Cloud. Seamless experiences, creating that digital experience across to improve patient and member experience on any device from anywhere. That is probably becoming the key right now, that it can be, I can be sitting in a cafe and working, or I can be anywhere where I am able to access my document, approve something, or apply for something very quickly. So that is what Adobe brings to the table. And it is obviously with these healthcare systems that is there, existing healthcare systems, how does a solution, a new solution, hook on to? Dr. Aditya mentioned that, it was more about how does the product understand what the hospital already has or what the healthcare system already has. So that is where APIs, which can hook on to your existing systems, become top priority. So achieve quick time to value. Adobe Document Cloud Solutions is helping you reach that goal. PDF, as I mentioned earlier, is an open format, but is a format that is the business file format. 40% of all documents that are received in Outlook today are PDFs, and 300 billion with a B plus files were opened in Adobe products alone last year. So that makes it the standard or the de facto across document formats. And that is where we can add over complexity like a security feature on top of it, the compliance feature on top of it, to make sure that what is getting shared is actually the exact thing that you wanted to share, or you wanted to collaborate on, or you wanted to archive on. So what does Adobe Document Cloud bring to the table? The Adobe Document Cloud brings desktop and mobile applications, which include Adobe Acrobat, Adobe Scan from the desktop or the mobile perspective. It has Acrobat Sign, which is a software as a service, which can be hooked on with APIs onto any of your existing systems. And we also have document services to actually accelerate the mundane tasks of getting data from a particular form, extracting it and putting it in your system of work. So how does that work? And that is where Adobe Document Cloud comes to the table. So with Adobe Document Cloud, what we have done is we have integrated into a very solid partnership with Microsoft. So world-class productivity solutions like CRM, a robust scalable cloud platform, and an expansive ecosystem is what Microsoft comes with. And along with the integration with Adobe, the leadership in design, document, and digital marketing solutions, we have formed a bond to make sure that our customers can actually work wherever they are, can get to deliver exceptional experiences internally as well as externally, and leverage their IT investment, leverage and optimize their IT investment. So let us take a look at what that means for us. When you're saying work from where you are, we're talking about just being in an ecosystem. You see, from OneDrive till the Azure cloud, every solution of a Microsoft that you use on a regular basis, how Adobe Sign can integrate with it. And you don't need to even leave the platform that you've been working on a regular basis. So we spoke about change, people and culture change, and we spoke about how people do not want to change. But if you are utilizing the same system, they don't want to learn a particular thing, a new thing altogether. But if they are using the same system and routing documents for signatures through that system, that would make life easier for them and increase their efficiency. When we're talking about Acrobat Sign through Microsoft Teams, we are able to send documents, we are able to track the document, we are able to see if the other person on the other side has opened the document. That put together, we can actually see if somebody is approved or signed on the document as well. But taking it a bit further, you can actually take this to deliver greater experiences as well within healthcare. So I like the point that Mr. G mentioned on health payer, how insurance needs to be hand in hand with the medical or the healthcare side, healthcare business. And that is where, so it can be with employee collaboration, human resources, procurement, what kind of processes that happen, or document workflows. I was searching for the word document workflows that happen across in the health payer side of the business, or coming to the health provider, where it can be a virtual consulting, it can be patient onboarding, enrollment life cycles, or even on the life sciences side of things, where there can be contract management, there can be procurement of a particular product or a solution, HR, everything that needs to go through any document processes, how we can deliver better experiences to exceed the members and patients expectations, because everybody, as I said, is looking at digital transformation across their portfolio of services they use, and they would expect the same from the healthcare segment. So delivering that healthcare experience, I was looking for this, where you can meet patients on a Teams channel and actually exchange documents and get them signed with Acrobat Sign as well. The major question, or the major obstacle that every customer would always have, is how do I know the person sitting on the other side is the person who should be signing this document? And that is where Teams face-to-face signing, or live signing as we call it, can solve that for us. So it will increase the organizational efficiency. We are reducing operational costs and improving the experience for our members and the patients. Moving forward, leveraging the IT investment or optimizing, as I was mentioning earlier, you see Acrobat at the center of it, but you see a circle with all things Microsoft. So we integrate with all the services that is already been invested by your organization on the Microsoft side. But that does not mean that that is the only partner we have. We actually work with Google, our CRMs like Salesforce and Viva, Workday and ServiceNow on the HR side of the business, or any hospital systems that you would have, or healthcare systems that you would have, which have an open API. So the products that you see on the screen are integrations that are already available with our product. It is already there. So it's a plug and play, username, password on one end, username, password on the other end, and plug and play. Whereas if you have systems which are not mentioned here, then how can we, APIs is the way that we can integrate with them and make sure that it is a robust system for you, for your customized workflow. So I'll just share a few Microsoft and Adobe customers in the healthcare and life sciences. Coming from them, Merck, which is a Acrobat Pro DC and Adobe Sign customer, along with Microsoft 365, has integrated with Microsoft SharePoint workflows, allowing Merck stakeholders to monitor the PDF documents that are sent for signatures and understand when they are returned back. There is CVS Health, who is doing the same, similar side, with administration control over the collaboration piece in documents that they are sharing. So Regeneron, Kaiser Permanente, these are a few examples, and these are something that are available on our website. I can share the link for you to go and read how these customers are utilizing Adobe solutions. I will jump to a few use cases and customer case studies in detail in the coming slides as well. Now, whenever we are talking about any solution, the first thing that comes to mind is how about security, and especially when we are talking about a cloud solution. And we are very, very happy or proud to say that compliance and security is in our DNA. That is one discussion that we would not shy away from. So if your team wants to speak about compliance, about security, we would be more than happy to have that conversation with you. But Adobe Sign presently is compliant with HIPAA, from the healthcare space, GDPR on the privacy, data protection and privacy laws. We are compliant with PDPA here in Singapore, and all the ISO certifications and the PCI DSS when it comes to payments, when it comes to credit card payments. PCI DSS is the compliance that is required, and we are compliant with these standards. These are worldwide or global standards that we are compliant with. And we are also a trusted leader when it comes to authentication. So one was the compliance side of things, but the other is the authentication. And as I mentioned, how does one know the other side, the person is the one who is signing, who is approving my document? And that is where email only or email plus password, email plus knowledge based authentication, like passwords on your social media, or any government ID verification, we can integrate with that, along with the Teams live signing that I mentioned earlier. So we are making sure that we are trusted by our customers on terms of authentication and compliance. We're looking at a true enterprise partnership, as Dr. Aditya mentioned earlier, was, how do we know that 25 years down the line, this company is going to be around and, work with you? That is the reason when we are looking at solutions that will help our customers and they want it in perpetuity, it is the format, PDF as a format is approved as in the worldwide standard organizations as the PDF for archival, PDF/A, which is for archival. So that's a worldwide standards format, and that will never go away because that is the open standard. It is not a standard that Adobe runs. When it comes to enterprise-wide workflows or experiences, we do have a customer success team who can work with you to make sure that you realize the value, your enterprise understands how the solution works and how best you can utilize it, how best you can optimize your investment. So that is something that we bring to the table. I did mention the ROI metrics. So if your organization, I'll take up Mr. G's invitation to really work with him on the ROI. But if your organizations are interested, please do write to us, and we'll definitely make sure that we can share with you a ROI calculator to share with you how much are you saving in terms of paper, in terms of water, in terms of carbon footprint. That's one side of it, but man hours and dollars on the other side. And with IDC, Adobe is a leader in e-signatures worldwide. So that is what the IDC report came up recently. The total economic impact, and this is one area that Forrester worked with us to understand how the reduction of costs would work out. And licensing cost savings is about 13%, where 25% reduction in e-signature solution costs, faster transaction speeds, that's about 43% there, improved experience value. So again, as I said, it is not only about the savings that you're making, but kind of experience that you're giving to your customers, and that makes it a lot more robust solution to go with. And sustainability cost, $21 per shipped transaction and 13.5 per printed or fax transaction. So those are the values where the ROI of a whopping 519% comes in for. But again, this is a research across those companies. If you want an individual one, we are very happy to go ahead and work with you on that. Now, document workflows exist across every function. So you see sales, remote work, marketing, HR, IT, product management, every place. But when we are looking at what the use case is specifically from a healthcare and life sciences perspective, it can be virtual consulting, as I mentioned earlier, or collaboration of documents, treatment consent forms, if at all those need to be digitally signed, enablement for people, how they can work and what are the policies that they should follow. That can be driven with the document management, the document lifecycle across. So from creating a document all the way up till signing and storing it and making it archival ready. What I mean by archival ready is not just storage of documents. It is not about taking a paper box and storing it, but how do I search that document? How do I make sure that that document is searchable when I want it, when I need it? And that is where cataloging, which Acrobat does on a regular basis with all the documents that you store in it, cataloging will allow you to search not the document by its name, but by the content of the document. So that's again a very important area that you should consider when we are talking about use cases in healthcare and life sciences. These are our Adobe and Microsoft customers across, by no means the entire list, but a subset of that list of customers across the globe. But what I would like to share with you today, as we are coming closer to the end here, is a case study. So St. Jude's Children's Research Hospital on cancer, they have actually started delivering faster content with Adobe's Experience Manager and telling omni-channel stories. So they say that with Experience Manager, we are looking forward to being able to add more technology to enrich experiences for our users. So it's all about user experience at the end of the day, as to how you can increase it and improve it to make sure that the users are with you. Coming to Merck, 1400% faster time to signature, from 7.5 days to half a day per transaction. That is what they added when they started working with Adobe Acrobat and Acrobat Sign across their workflows, to make sure that everything is a digital workflow. So new hire contracts returned in 1 day compared to 1 week earlier. So we are talking about loads of improvement and loads of time saving here. And then lastly, Roche, which is talking about 50% faster production of PDF documentation. So whenever there is documentation needed, when there is collaboration needed, when there is approvals needed after the collaboration, that happened 50% faster, because everything could be done over digital with the help of a phone or a laptop or a tablet. You could go ahead and approve or collaborate with on documents with Adobe Acrobat and Acrobat Sign. So those are a few case studies that I wanted to share with you. It was a very quick presentation, but I would love to see if at all there are any questions for me. And we will also have a poll where we would like to understand how you would like us to get in touch with you to share more, because this was just a glimpse of what Adobe brings to the table. So if you can go to the poll, yes. And so in the meanwhile, thank you everyone for listening to me. It was a pleasure bringing this to you. Thanks a lot. Pete, you would want to go to the poll?
Yes, thanks very much, Rajesh. So the poll has been shared already.
Yep.
So just giving them quick time to actually get to answer that. Okay. And yes, thanks very much, Rajesh, for that very valuable information that was shared in your presentation. And I didn't see any other questions that did come in. Let me just take a look once more. Yep. So there are no other questions that did come in. So we will be wrapping things up here today as they continue to answer the poll questions. And to the delegates, I hope you did all have an enjoy all presentations on this digital Rajesh's expertise, and of course that presenting earlier as well. And as we do come to the end of today's event, I would like to remind all of you that, of course, if you have any more questions, would like to know more about what was discussed today, you may always feel free to reach out to Rajesh himself personally as well. You can always reach out to him, the team, and surely they'll be committed to providing you with the best possible resources to help you get started and to succeed. And finally, I would like to take this opportunity to inform and invite you to our upcoming events. So we do have a number of exciting events lined up for this year. The most recent being the 3 conferences that are listed on there. So the Cloud Native Open Source Philippines Conference, that will be actually this month, at the end of this month in Manila, Philippines. And then our 2 CyberSec Asia events that will be taking place in May. That's going to be in Malaysia, and the Indonesia conference, which is going to be in Jakarta, Indonesia in July. So do feel free to reach out to us. Keep an eye on our website as well, social media channels for more information where you can register. And with that, I'd like to thank everyone for joining here today, and hopefully we'll be seeing you all in our future events. So thanks everyone, thanks, and have a nice day ahead.
An electronic signature, or e-signature, is a broad term for any electronic process that indicates acceptance of an agreement or a record. But when an e-signature is backed by a digital certificate that proves the signer's identity, it is called a digital signature. Digital signatures are recognized as being more secure and legally binding around the world, most commonly in the European Union. This is because digital signatures provide the highest level of assurance to prove a signer's identity that the signer signed a specific document and that that document and signature has not been altered. At the core of each digital signature is trust that the signer's identity has been appropriately verified. This can be done by a trusted identity authority who then issues the signer with a unique digital identity certificate. Then, to apply a digital signature, the signer simply needs to validate their digital identity, such as with an app or PIN, to sign a document. The signer's identity information from their digital certificate is cryptographically bound to the e-signature to demonstrate proof of the identity of the signer, as well as what, when, and why they signed the document. Each digital signature and the signed PDF document are time-stamped, secured with a tamper-evident seal, and encrypted. And the signed document and digital signatures can be revalidated for at least 10 years. Digital signatures are commonly used in transactions where required by law or to minimize risk when important, to proactively prevent forgery or tampering of a signed document.
The day that we had to start shutting down our restaurants. This was not easy. I remember crying.
Breaking news, all restaurants and bars in D.C. must stop serving sit-down meals in just a few hours.
He had to get rid of half of his staff.
We have never faced anything like this before.
This was a hard moment because you want to be there for them, because you know they've been there for you. Restaurants restore who we are every single day. Obviously, shutting them down initially was hard, because where do we go to restore ourselves? Adversity, unfortunately, is when the best of every human being shows up. I decided that the darkness was going to become light. When a restaurant is open, it's a lighthouse sending a very big message that the entire system is back. Food is everything. Food is our history. Food is science. Food is life. Food is love. Creativity, adaptation. Technology helps in so many ways. We used to do it with a piece of paper and pencil. Now, boom, you got it on your palm. If you work in a restaurant, you're ready for anything. You know, for a plate to come all the way to your table, a lot of things happen.
Maria, anda!
I think 2020, this pandemic, has been the year that we began being thankful for the things we really have. One dish at a time, we are rebuilding our communities back.
At Adobe, we're all about powering business creativity and continuity anywhere. The digital-first hybrid workplace is now here to stay, and Microsoft Teams has been at the forefront, creating a powerful platform for organizations to stay connected. This has enabled us to bring the power of Adobe apps like Adobe Sign, Creative Cloud, and Acrobat right within Teams. With Adobe Sign for Teams, we're making e-signature experiences in person again in video meetings. And with Adobe Sign powering Teams approvals, adding an e-signature is quicker and easier than ever. This all goes hyperscale in Power Platform with Adobe connectors enabling you to create your own apps with e-signatures and document workflows in Teams. Whether it's government services, telehealth consultations, or complex financial agreements, Adobe and Microsoft are reimagining how work gets done wherever you are.
It's a goal! Amazing! They've finally done it! They're moving to the first...
Yeah, sure. No.
File too big. What?
Flower growing wild and free, all I'd want is you to be my sweet honeybee. And if I was a tree growing tall and green, all I'd want is you to shade me and be my leaves.